Imagine if you went from feeling like you could conquer the world to suddenly drowning in extreme sadness. Well, this is how some bipolar patients describe how they feel during manic and depressive episodes. And joining us to discuss the disorder and how it can be managed is an expert in this topic, Dr. Gary Sachs. Doctor, thanks so much for joining us.
Thanks for having me, Al.
So we're talking about specifically bipolar I disorder. What is that?
Yeah, that's a condition where patients sometime in their lifetime have had at least one manic or mixed episode. And when we say episode, we mean in addition to those mood states that you mentioned, they have a constellation of symptoms that can affect their energy, their ability to think, their ability to assess risk. So these can be really impactful on their lives. It can make it impossible to hold a job, sustain a relationship. And the important thing is that we now have a good number of proven treatments that work for manic or mixed episodes. So the main message I want to get across to people is let's get that diagnosis confirmed. If it's there, let's move on to one of those proven treatments.
Good point. And I mean, some of those things you mentioned really can affect somebody's life and really make it hard to live sort of a normal life. And so what should patients be asking their doctors about their condition when they go in and see them?
You know, I think it's really important to make sure that you have a full formal assessment of your diagnosis. And if you're told you have a manic or mixed episode or you have bipolar I disorder, ask your doctor, what are the proven treatments for the condition I have? They will give you that short list. It's like an exclusive club. And you always want to start your treatment there. When I started my career, the only member of that club was lithium. Now we have about a dozen members. The most recently approved is a drug called Vraylar. And more commonly, the class of drugs that Vraylar is a part of, so-called antipsychotics, because these drugs were first approved for schizophrenia, but have now been proven to be effective for manic and mixed episodes and gotten FDA approval. Those are the drugs that are actually most commonly used acutely. So making sure that you read through those with your doctor, establish your preference, and make sure that you understand that potent treatments also can have risks. In patients with dementia, the elderly patients, there's an increased risk of stroke and even death. But for bipolar patients, these are terrific treatment options, and you ought to discuss all of them with your doctor and make the choice that you and your doctor conclude is best for you.
Well, and you know, before you even go in and see the doctor, how can someone tell the difference between, say, depression and bipolar disorder? Because there might be some similar symptoms there, right?
Yeah, so, you know, it's an important thing. While you're in the midst of it, you're always viewing yourself in the world through the prism of your mood state. And when you're in an abnormal mood state, it's really hard for you to perceive that. You might get it right, but more likely you're going to get feedback from people around you. And if you're having people ask you why you're so angry or why you can't sit still or could they get a word in edgewise in a conversation, that might be tipping you off that something is wrong. And going in and talking to your doctor about that, making sure you get a formal diagnosis. A lot of times what people are aware of is this sadness, this downside, which can be a part of mania. In fact, it is the most typical complaint for patients to have when they're fully manic. So we need to go beyond, you know, what's bothering you the most to that full constellation assessment and see if you meet criteria for mania or mixed, because if you get treated for depression while you're manic, obviously that would be a mistake.
Right. Well, this focus on mental health is really so essential to moving forward, you know, in terms of our healthcare as a country and also just the people. You know, they need to focus on their health, their mental health a little bit more this year. So, doctor, if people want more information, where can they go?
You know, I recommend the website from the Depression and Bipolar Support Alliance. That's dbsalliance.com. There's a wellness tracker. There's a lot of other resources patients can look for, and even resources for families.
Very good. Dr. Gary Sachs, thanks so much for joining us today.
Thank you, Alex.